Good morning, everyone, and thank you all for attending today's very important announcement. As the Minister of Arts, Culture and Status of Women, it is my role to foster opportunities for women and girls to lead fulfilling lives and help build stronger and safer communities in all corners of our province. That's why I am so excited to be here for today's announcement. It signifies a meaningful step forward in our government's ongoing efforts to improve the health outcomes of women and children across Alberta. I would now like to turn the podium over to Premier Smith for remarks.
Well, thank you, and good morning, everyone. I'm pleased to be here with Minister of Health, Adriana LaGrange, Murray Sigler, President and CEO of Calgary Health Foundation, Dr. Erin Brennan, who is the Department Head of Obstetrics and Gynecology at the University of Calgary, and Charlene Rutherford, President and CEO of the Alberta Women's Health Foundation, to share an important announcement on investments that we're making in women's and newborn health. Our government was elected on a mandate to improve Alberta's healthcare system and make it work better for every Albertan, and that's exactly what we've been doing. Last year, we announced our plans to refocus healthcare, and Minister LaGrange has been working tirelessly on delivering on those plans. In April, we announced the creation of Recovery Alberta, our province's new mental health and addiction organization. Just last week, we announced a new program enabling nurse practitioners to offer primary care services, expanding access to primary care practitioners for people across the province. And the week before that, we announced a framework for a new funding model for our frontline healthcare practitioners, our medical doctors. We're committed to improving health outcomes for all Albertans, and an important part of that commitment is improving outcomes for women and children. Today, we're happy to announce that we are keeping another platform commitment by investing in women's health and newborn screening. Alberta is home to some of the country's best universities and research institutions, which regularly contribute cutting-edge research in a huge range of fields, and that includes medical science. We want to ensure Alberta's position as a leader in women's health research and increase our ability to attract distinguished researchers from other parts of Canada and from around the world. That's why we're investing $20 million over 2 years to advance women's health research in Alberta. $10 million will go to the Alberta Women's Health Foundation to support research on common women's health conditions, and $10 million will go to the Calgary Health Foundation to fund health projects that will make breakthroughs for possibly thousands of Alberta women. This funding will strengthen Alberta's position as a national leader in women's health and enable our province to provide better care to nearly 2 million women in our province. We also have a program for newborns. As we learned last week through the annual baby names announcement, Alberta families welcomed over 47,000 newborns into their families last year. Every expectant family dreams and prays for a safe birth of a healthy child. And that's why we're also fulfilling our campaign commitment to expand the Alberta newborn screening program. When parents welcome a newborn, they want answers and certainty about their baby's health as quickly as possible. The last thing that they want to do is wait. The Alberta newborn screening program is offered to virtually every baby born in Alberta shortly after birth, and it analyzes the newborn's blood for 22 treatable health conditions. We know that early detection is critical for promoting healthy development in newborns, and this program has been a big success so far. We want to give babies born here in Alberta the best possible start in life and their families the peace of mind that they need. So we are expanding newborn screening to include 4 more conditions, which will help the youngest Albertans get the care they need as quickly as possible, because healthy families are the foundation of healthy communities. And with that, I'd like to invite Minister Adriana LaGrange to share additional details.
Thank you, Premier. And I want to thank all of you for being here today as we announce funding that will support the health and well-being of women and children across this province. Alberta's government is firmly committed to improving the healthcare system across the province, and we have made significant strides to make sure that Albertans have the healthcare they need, want, and deserve. I am pleased to be here today to share our plans to invest $26 million to support health outcomes for women and children in Alberta. Each year, a small number of Alberta infants are born with metabolic disorders that can lead to severe physical disabilities, developmental delays, and other health problems, or even death. Detecting and treating these disorders early supports healthy development and can lower mortality and disease rates. The Alberta Newborn Screening Program currently screens for 22 conditions and ensures all screened infants who may have one of these treatable conditions can get clinical assessment, diagnostic testing, and early treatment if needed. I stand here today to tell you this program is a success. Based on the most recent data from 22-23, the screening program has screened 99.2% of all Alberta-born infants and reported screen results for 98.95% of those infants within 10 days. As a mother and a grandmother, I am grateful for the comfort this program brings to so many Alberta families. Through Budget 2024, we will invest $6 million into the Alberta Newborn Screening Program. So this investment will build on its success by adding 4 additional screened conditions, increasing the number from 22 to 26. This will make the program one of the most comprehensive in the country, as Alberta will be the first province to screen for the 4 new conditions. Improving infant health care goes hand in hand with supporting women's health. Further investment in research, advocacy, and clinical care for women is vital. And so we are investing $10 million to create the Alberta Women's Health Foundation Legacy Grant to support research on cervical cancer, heart disease, and other common health conditions that disproportionately affect women. This grant will support the Foundation's efforts to attract top researchers to Alberta, to assist in the discovery of medical breakthroughs, foster awareness by empowering individuals to make informed choices about their health, prioritize preventative measures, and seek timely care when needed. And also promote advocacy by supporting organizations dedicated to championing the rights and needs of women, ensuring that they can access the care they deserve. In this spirit, the Calgary Health Foundation will also receive matching funds of $10 million over the next 2 years to continue funding women's research initiatives, attract health innovators and researchers to the province, advance women's health research, and improve clinical care outcomes for women in Alberta. Improving access to health care and funding groundbreaking research and initiatives focused on the unique health challenges of women will improve health care outcomes for families today and well into the future. And as only the 5th ever female Minister of Health in Alberta's 119 long year history, I am very proud to be part of today's announcement. This is an area of the healthcare system that I really hold near and dear to my heart. And to be able to be standing here with these other incredible women, all working towards the same goals of improving the health and well-being of women and children in this province is really, truly an honor. And so through this $26 million investment, we will ensure every Albertan can thrive, no matter their age or stage in life. And I am just absolutely thrilled to be here to make this announcement. You don't even know how thrilled I am. I'll now turn the podium over to Murray Sigler, President and CEO of the Calgary Health Foundation, for his remarks. Thank you.
Thank you, Minister, Premier, Minister Fair. On behalf of all of us at Calgary Health Foundation, I'd like to thank Premier Smith, Minister LaGrange, and Minister Fair for the significant investment in women's health. This $10 million injection from the Alberta government marks a significant milestone for women's health in our province. And Calgary Health Foundation will work to leverage the Alberta government's investment by raising additional funds for women's health. Women's health is one of Calgary Health Foundation's top priorities. We are currently supporting several initiatives including an innovative breast cancer project impacting the patient experience, as well as programs for the pelvic floor clinic in Calgary, both of which will significantly impact women's health. Calgary Health Foundation is committed to further funding female-related clinical care, research, and education. Calgary Health Foundation is working closely with Alberta Health Services to identify and strategically invest in women's health to help close the gaps between diagnosis, treatment, and care. Through partnerships like the one with Dr. Erin Brennan and the Calgary Pelvic Floor Clinic, this investment will enable us to give the necessary attention, funding, and advocacy to the unique health challenges women face every day. A reduction in waitlist times, the building of additional examination and treatment spaces, the expansion of existing initiatives, and the creation of new innovative programs focused on priorities identified by women are all possible thanks to this new investment. Generous Calgary Health Foundation donors have already funded important women's health initiatives, such as state-of-the-art gynecological equipment and postpartum emergency improvements. And we invite the community to join us in advancing this important initiative right here in Calgary. We are grateful to the Government of Alberta for its support and are excited about the future impacts this investment will have for women's health. Thank you. Now I'd like to call on Dr. Brennan.
Good morning. I'm Erin Brennan, the Department Head for Obstetrics and Gynecology here at the Cummings School of Medicine and for Alberta Health Services Calgary Zone. I'm also a practicing gynecologist here at the Foothills Medical Centre. I'd like to thank Premier Smith, Minister LaGrange, and Minister Furr for today's announcement of directed funding for women's health through the Calgary Health Foundation. The Foundation is committed to equitable health care for all, including prioritizing women's health and addressing the unique challenges that women face. This investment represents a tangible first step towards removing gender disparity in healthcare practice, policy, research, and delivery. It's time for women's healthcare and research to get the attention and funding it deserves. Presently, diseases and conditions that specifically impact women are misunderstood and poorly treated. As a gynecologist, I hear about the struggles of women in our community to access care for menopause, a condition that affects every single woman, pelvic floor disorders, which affect 50%, as well as for common conditions such as endometriosis and polycystic ovarian syndrome. I hear this on a daily basis. And these challenges are echoed by my colleagues in primary care who report struggles to connect their patients with appropriate therapies and resources for these and other women's health concerns. We know that improving the health of women has wide-reaching effect, benefiting communities and society as a whole. Healthier women are better able to function in the pivotal roles that we hold in our families, participate in the workforce, and ultimately contribute to the economy of this province. With this $10 million investment, we hope to begin the development of a rapid access clinic for gynecologic conditions. We want to lay the foundations for innovation in the training of women's health specialists to meet the needs of urban and rural patients. And we want to create a women's health innovation and research hub here in Calgary. We envision a future where women's healthcare receives adequate attention, resources, and we know that the Calgary Health Foundation plans to be at the forefront of driving that change. Ultimately, today's announcement reflects our government's acknowledgement that investing in women's health is an investment in a prosperous Alberta. I applaud the government for making this first step to address the historical gap in women's health. This commitment to improving the lives of women will have a profound and lasting impact for generations to come. Thank you, Premier Smith, Minister LaGrange, and Minister Furr. And with that, I'd like to turn the podium over to Charlene Rutherford.
Good morning. On behalf of my board of directors, led by Chair Dan Lefebvre, it's my immense privilege to stand here today alongside the Premier and Ministers LaGrange and Minister to highlight the importance of supporting women's health research in Alberta. Research is the track that the engine of clinical care follows. Advances in diagnosis and treatment always begin with research, and today the Government of Alberta stands shoulder to shoulder with our province's 2.2 million women and girls and their healthy futures. The Alberta Women's Health Foundation directly supports the work of more than 160 researchers in our province who are collaborating provincially, nationally, and internationally. Some of these researchers are based at the Dale Sheard Centre for Solutions in Women's Health at the Lois Hole Hospital for Women in Edmonton. And I want to say another thank you to Minister for being part of that wonderful opening and celebrating that centre with us. We're still celebrating. It's fantastic. So we are grateful to receive these dollars, an investment that will continue to advance current projects and the many emerging opportunities in research that are before us now. And this is happening because more scientists are placing their focus in areas that have historically been difficult to research due to lack of funding and/or lack of participation in clinical trials. These gaps are historical, and they are precisely why unexplained side effects, long delays in diagnosis, and even misdiagnosis continue to occur across the women's health spectrum. We also know that women face a unique set of barriers in the workplace due to events that limit their progression, curb their potential, and even cause some women to leave the workplace entirely. In our own report, Surveying the Silence, more than 2,200 women in Alberta responded to our survey and shared the gynecological health conditions that cause significant challenges across aspects of their lives. And Doctor, you referred to some of those. So pelvic pain, polycystic ovary syndrome, to fibroids, to menopause. We learned that women's health is directly correlated to their capacity to achieve in the workplace and in their personal lives and in relationships. Menopause is an excellent example. As we learned in our report, 75% of women who suffer from the debilitating effects of menopause say the challenges are so impactful that it directly impacts them at work. And 10% indicate that they could consider leaving the workplace. And women going through menopause now are more likely than previous generations to hold senior roles at work, making them difficult to replace. These are women who are people leaders, culture leaders, C-suite executives, and board members. And they're a growing cohort of women who are more likely to have good salaries and disposable income, and who are also invested in finding answers. We know that women's health equates to women's wealth and serves to bolster economies. So collaborations like this across the public, private, and not-for-profit sectors are becoming so important. And certainly this exciting announcement by Premier Smith today demonstrates the investment and the leadership that ultimately leads to improved health outcomes for our women, their families, and therefore our communities. This $26 million total investment from the Alberta government will serve as premium fuel for progress, igniting innovation, and refining outcomes for all. Because when we solve for women, we solve for society. So thank you so much once more, Premier Smith, for this investment. Thank you, Minister LaGrange, and thank you so much, Minister, for... Thank you.
Thank you so much, Charlene. To close, I would like to extend a heartfelt thank you to both the Alberta Women's Health Foundation and the Calgary Health Foundation for the work they do behind the scenes and for their commitment to health projects that enable breakthroughs for thousands of Albertans. Your contribution to women's research plays a critical role in ensuring that vital health information remains readily available and is a fundamental cornerstone in enhancing personal well-being and strengthening family health care across our incredible province. I will now hand over the podium to the press secretary to continue with the remainder of today's event.
And please state your name and outlet for the record. If you are here in person, please line up at the mic. And I'm seeing someone making their way to the mic. All right, first to the mic, please go ahead.
Back here, Tim Brooke with CTV. This question is for the Premier. I see that there are some proposed amendments right now going to Bill 20. I noticed the softer language there, but can you tell me specifically what's changing here and why municipalities should be happier now than they were last week?
A couple things. So when we introduced legislation, I'm glad we introduced it just before our constituency break. We all had a chance to go and talk to our various councils. And two of the areas that they were concerned with being overly broad were the parameters around when the province might nullify a bylaw and when the province might remove a council member. The way the legislation is written is if it is deemed in the public interest. And we were asked by the various municipal associations if we could just be more clear about what those terms would be. So we're working on the language on that, and we'll be introducing amendments when we go back next week.
And then my second question, completely unrelated. I'd like to know, what is your personal relationship with Jennifer Johnson, and will that impact in any way your decision to allow her back into caucus?
Look, I mean, we have seen that there have been pathways for MLAs when they mess up to find a way back into caucuses. It happened in the NDP caucus, and I've asked Ms. Johnson to do the same thing, that she's got some work to do to make amends with the LGBT community. And at this moment, there's no discussion about that. She still has some work to do.
What's your personal relationship with Ms. Johnson?
She was a candidate. She was a supporter of the UCP. She's still a party member. She sits in the legislature as a duly elected member. And I have a relationship with her like I do other duly elected members of the legislature.
All right, thank you. Next to the mic, please go ahead.
Hi, Sean Polzer, Western Standard. Question for a colleague. Given Minister LaGrange's past involvement with the pro-life movement, is there any thought to giving restrictions on abortion similar to what we're seeing in some United States?
No. No.
Okay. Thank you. And then a question for me. Now that the Trans Mountain Pipeline is on stream and supposedly up and running, what are the next steps to, say, divesting it, and what would the role of the Alberta government be in that?
Well, I sure hope it's up and running. We're banking on that. We were very pleased to see that Trans Mountain went into service on May the 1st. I understand that it's already well on its way to being filled. There are orders that have been made with both China and India, and I suspect we'll see more of that. The next steps, as I understand it, is that the federal government wants to get the Trans Mountain Pipeline into private hands. We've already signaled our intent to assist on that if they need some assistance on the Indigenous ownership. I think they have said that they want Indigenous partners to own anywhere from 20 to 30%. My recommendation is they get that as the first piece. And so we have an Alberta Indigenous Opportunities Corporation. We increased the backstop from $1 billion to $3 billion in order to be able to facilitate if we needed to. We were pleased to see that both British Columbia as well as the federal government followed our lead. There's a BC Indigenous Opportunities Corp that has a $1 billion backstop, and the federal corp has $5 billion as a backstop, and they've said that that's just the beginning, and that it is also intended to be able to support projects like this. So my understanding is that 80% of this pipeline is debt financed, and it was likely to stay that way. Which means that the tolls associated with paying that off will be paid by the producers, and then they just need to equity finance the remaining 20%, which is about a $10 billion share issue. So that just gives you some idea, I think, of how they have to put this deal together. If it's 30% Indigenous ownership, and then it will go to the market, there'll be the remaining 70% ownership from private players, and then the bulk of the pipeline will be paid off with the tolls. My anticipation is that there would be no taxpayer dollars that would be spent on paying for this pipeline. It was paid for by the federal government to get it to the finish line because Kinder Morgan was going to walk away with the regulatory uncertainty. We're glad that happened. We're sorry it went over budget, but I think this is still going to be a hands down win for the country. It'll be paid off by the private sector. We will get a higher value for our product. We'll get more of our product to market. It'll generate more royalties, more corporate income tax revenue. It's a win all the way around, and it's a delight to see that we can actually, as a country, do these kind of nation-building projects once again.
I don't want to overstep, but do you think that the federal government is going to have to take a substantial write-down on this investment?
I don't. I'm not. Because of the way it can be financed, I believe, with 80% debt finance paid by tolls, that's paid by the shipper, and then they just are going to get the equity stake into private hands with the assistance of a loan guarantee, and we're happy to help with that. So I'm not anticipating a write-down.
Next on the mic, go ahead.
Hi, Premier Mark Villani here with CTV Calgary. Another unrelated question for you. In Ontario, the OPP is mandating breath samples now during all GTA traffic stops in an effort to prevent impaired driving. Just wondering what your thoughts are on that program and if it's something you'd like to see implemented here in Alberta as well.
Sorry, can you say what they're doing?
Yeah, in Ontario, the OPP, they're mandating breath samples for any standard regular traffic stop. So even if you roll a stop sign, for example, they could pull you over and ask for a breath sample.
I don't know it would be appropriate for me to direct the police on anything, so that might be a question better put to the Calgary Police Service or the RCMP or our sheriffs.
Thank you.
All right. Sure, go ahead.
Doing dual jobs here today. Nick with City TV. It's a quick question back to what we're announcing here today. Just the importance, I know it was kind of a twofold, like the infant side of things and having the ability to test the blood and all of these things. Can we just a little bit that importance, like the ability to be able to detect these things, once the young mother's in the hospital and the baby is born, how important is it to have those blood samples tested right away and all these additional things that they can look for?
Well, it's extremely important. So typically what is done is the heel prick test on a newborn baby, and the blood's taken and then it's sent for analysis. And the quick turnaround of that analysis is extremely important because if there is one of these conditions prevalent or present within that infant, we want to be able to start treatment immediately. And sometimes it goes undiagnosed. And if it goes undiagnosed, then it can lead to developmental delays. It can lead to even death. As a rehab practitioner in my former life, working with the developmentally disabled, I saw situations that resulted from some of these conditions that we do test for. So it's extremely important that we're already testing for the 22, that we add the additional 4. And as I said, it'll make us a Canadian leader in this area. It's just extremely important. The sooner we can detect, that early intervention process kicks into place. And as I said, we're testing virtually 100% of children in the province. Yep. Oh, perfect. Sure. Yes.
Hi, so I'm Dr. Eliza Phillips. I'm a metabolic physician. So I follow these children and their families after they get the call that the newborn screen is positive. And I see every day the difference that that the early diagnosis of these conditions make. It can be the difference between a child who is severely disabled and a child who will grow up healthy, normal development. And it's life-changing. So there's all these new developments in treatments and advances in diagnostics that allow us to continually add new conditions to the newborn screening. So it's just life-changing for these families.
Follow up, because there was a lot announced here today. The other one I heard, and I apologize, is this young lady over here. The quick access clinic too, part of that funding might be going to this clinic. The importance of that clinic, like for women's health especially too. I am not an expert at all. So what's the importance of having that quick access clinic and some of these things? Because like we said, 2.2 million women, and they're a huge part of the workforce. So the importance of that clinic.
So I'm Erin Brennan. I'm the department head of obstetrics and gynecology. A rapid access clinic for gynecologic conditions is something that women in the community identified as a priority. We know that the wait for reproductive health care is growing. It can be as long as 2 years to see a specialist in the city. I am telling the truth when I say that every single one of my call shifts here at the Foothills in the last 2 months involved telling a woman that she had advanced reproductive tract cancer because she couldn't be seen for her uterine bleeding fast enough. And so development of this clinic will not only improve the quality of women's lives, but the quantity and the length of it. This will be pivotal. It will be so important for my colleagues in primary care who are overstretched and overburdened to have an easy pathway for their patients to follow.
All right, thank you. Seeing no more questions on the floor, we will turn over to the phones. Operator, please put through our first caller.
Thank you. Janet French, CBC. Janet, your line is open.
Maybe next one.
All right, operator, she's having technical difficulties, so let's turn to the next caller.
Thank you. Hello, Rick Bell. Sorry, Janet, please go ahead.
Oh, hi. Sorry, button got depressed. Just a question about newborn genetics to disease screening. The election platform from 2023 said that you would, AHS would be analyzing 5 of these genetic disorders, and then we've just got 4 that are funded. I'm just wondering which one, if you can tell me what the process was to determine which ones were going to be funded and which one you left out and why.
Turn that over to Minister LaGrange.
In fact, the 5th one is already captured in the 22, so it wasn't necessary to capture that one. So we have actually addressed all 5 that were reported earlier.
Okay, thanks for clarifying that. New topic, just a question about ISO. The Narwhal was reporting this morning that new voice documents from inside ISO showed that the CEO was not on board with any renewables pause. Mike Law said that it would throw the industry into a, quote, tailspin. So why did the Premier say that ISO had asked for this pause?
Look, what we had heard in our conversations with the electric system operator is that we needed to explore how to integrate a responsible amount of solar and wind into the system. And quite frankly, seeing over a dozen near misses on our power grid validates that we need to figure out how to integrate these. What happens, and I visited the electric system operator control room, it's about 5 guys who are watching what's happening with wind and solar, and they have to amp up natural gas when wind and solar suddenly come off. And I asked all of them, I said, would this be a little bit easier if we had reliable power? And every single one of them nodded their heads. So we have to figure out a way to get a more reliable market, and that is going to be the next stage of our development. So I would say that the facts speak for themselves, that we used to go years without having a power grid near failure, and now we've had multiple in the last short while, and a lot of that is because of the intermittency of power that comes on and off without predictability and can't be dispatched. So whatever they're suggesting, I would have to beg to differ, that my job is to make sure the power grid doesn't fail. And if solar and wind policy needs to be changed so that it can be integrated better with our system and we can bring on baseload power, that's my job to make sure we do.
Please put through our next caller.
Thank you. Rick Bell, Post Media.
Good morning. Question for the Premier. Big money question here for you. After the City Hall received the news that the low-income transit pass would be continued funding, they said, thank you very much, and then said, we want $311 million a year more from the province. But this is just the beginning. They call it a funding shortfall. They point directly at your government, and they blame you for shorting them by this $311 million a year. And the figure is even contained in a report that they're going to be discussing soon called Understanding the Funding Shortfall from the Province. What do you say when you hear, particularly the mayor as a spokesperson for City Council, wanting $311 million a year more from the provincial government?
Well, I would say I'm always open to hearing from our mayors and our municipal associations about where there might be funding gaps. But I would also mention a couple of weeks ago I saw the City of Calgary bragging about a $238 million surplus most of which they put into reserves, 200 million of which was unexpected because of their overcharging on local access fees. So we've had to correct that. I think they do have means because of the extraordinary increase in regulated rate option and how they charge their fees to be able to address some local pressures, and I'm glad they have the ability to have their own source revenue to do that. We also fund the city $225 million in local government fiscal framework funding to support their priorities. We also, and I may as well just go through the list here, Rick, 18 school projects in Calgary, $55 million to the University of Calgary, $667 million over 3 years for Calgary LRT, including $43.4 million to extend the Blue Line to 88th Avenue to support future connection with the airport, $524 million over the next 3 years for Deerfoot Trail upgrades, $7.8 million to develop the Olympic Plaza and expand the existing Arts Commons, $103 million over the next 3 years to develop long-term care beds, $70 million over 3 years to increase capacity at the Foothills Neonatal Clinic, $67 million to redevelop the Peter Lougheed Centre, $48 million for the Calgary Cyclotron facility, $700 million to relocate kidney patients for Northwest Dialysis. Like, we've got a number of ways in which we support the city of Calgary, and in fact we're very diligent in making sure that we have equivalency between our two major cities. I believe we're up to about $3 billion in capital funding for both Calgary, or for each of Calgary and Edmonton over the next 3 years. So I know there's always pressures at the city, and I think we've identified a great number of them, and we're funding them.
My supplementary question is, because you hear this a lot from readers who just can't believe, who know how much money the city council has, and yet they continue to plead poverty, that the cupboard is bare. Just to clarify, Premier, that favorable operating variance of $237.7 million, basically found money, then the franchise fee variance is on top of that. That's another $200 million on top of that, and then there's an NMAX dividend variance, which of course is because the power bills have been so high, and then they have a multitude of reserve funds on top of that. So when the public, when Albertans, because you're responsible for money for Alberta taxpayers, when Albertans see the amount of money that the city of Calgary has, and at the same time they're pleading poverty, I mean, what is your feeling when you hear that?
Well, year after year, whenever they had their surplus announcements, I would make sure that when I was on the air that Calgarians knew about it. We see this every year, that they underestimate what the revenues are going to be, overestimate their expenses, they generate surpluses, and then they put it into their surplus accounts, and then they increase taxes. So that's something that Calgarians are going to have to hold them to account for, but we watch that, we see that, we know that they're running surpluses, so we know that they have means to be able to support their most urgent priorities. We also know we have a responsibility to support these big projects, and we're going to support these big projects. But we have 350 municipalities in Alberta that we have to take care of. And I can tell you, there are only 2 cities that are getting over $600 million to support their LRT systems, and that's Calgary and Edmonton. And so we have to be mindful that we've got to be fair, and we're going to continue to be fair going forward. We want to make sure that our 2 big cities are supported, but we also have to make sure that all of our municipalities get the resources that they need to.
Thank you.
All right, thanks everyone. That's all the time we had this morning. Thank you for coming out.
Thanks everyone.